Summit in Berlin earlier this year. So I'm very much looking forward to this opportunity to share essentially more about how our two organizations are collaborating and what potential we see for the future. So yeah, very much looking forward to the opportunity. Thank you, Stephen.
Thank you, David, and thank you, Fatimata, for joining. As I mentioned, for those who don't know, Fatimata is new to IFRC. We're very lucky to have a very dynamic and engaged Director of Ethical Practices. So that's where the protection, gender inclusion work fits in now. And Fatimata, if I just give you the chance to say hello.
Thank you, Stephen, and thanks all actually for joining this very important event. I'm very glad, Stephen, as I have told you, to see that disability is literally disability inclusion is part of our approach and strategy. And as a new director of the ethical practices, of course, I will be here to supporting moving the agenda to the next level. So very glad to see that with our CBM colleagues, we are also having it as a key. And I'm really looking forward to see what are the best practices, what are the opportunities, what are also the challenges maybe we are facing together and how we can move forward to the next level. Thank you.
Wonderful. Thank you so much. Okay, so good morning from me. I'll just spotlight myself whilst giving a little bit of an introduction, and then I'll hand over to my colleague Sander. So I'm Stephen Wainwright, and I am Social Inclusion and Protection Coordinator at IFRC and the Disability Inclusion Focal Point. And I've been working with Sander Schott from CBM and with David Bainbridge from CBM and other CBM colleagues to really look at how we can work better together, how we can collaborate more deeply, more meaningfully, and so on with the existing collaborations that we have actually with CBM and some national societies. And as many of you will have seen, we're going to have some examples of that today. We're going to hear from Kenya, from Australia, from Nepal, and from Bangladesh, and we'd be very happy to hear from other people here, your experience or what you might see we might be able to further collaborate at the country level and the regional level. So before we do get started with all of that, just a few points. First of all, please do introduce yourself in the chat, your name and your country, the organization that you're working for. And throughout the webinar, please do use the chat to add comments and questions, and we'll come to those at the end. Just to mention that some accessibility tips, if people have some need for improved vision or other ways to engage a bit more easily with the presentation. If you're not already aware of some of that, we're using PowerPoint Live, which gives you the possibility to zoom in more easily on the PowerPoint. You can also change the contrast. The translation of the slides is also possible. So in what you can see on your screen there, just below the PowerPoint, there's these three dots like you can see on the image. And if you click on those three dots, it's just where you see the number of the slides and then a little square and then three dots. And then you can magnify the slide, you can change the contrast of the slide, and you can also translate them. Hopefully that's clear enough for others. If not, do put a question in the chat. We'll try and support. In Teams, as many of you will probably know, you can turn captions on. So if you have some difficulty hearing or just following without captions, that's an option for you as well. And you can see the image there on the slide of how to turn that on. It's slightly different in different settings, but it's normally more and then language and then turning on captions. So that's another option. One other point that you can use to improve your engagement, if when Teams presents a presentation, everybody becomes very tiny and the presentation becomes very big. But if you prefer to see the person in the presentation, simply click on the video image of any of the people or the person who's talking, and then they'll become bigger and the presentation will become smaller. You can also pop out the video the PowerPoint presentation. That's a little bit more complicated, but just clicking on the video will make it bigger. For all the presenters, please do introduce yourself and say what is on the screen if it needs explaining. And as I'm already probably doing, please do avoid to talk too fast, and please do message in the chat or react in some way if the speaker's speaking too quickly. That brings us to 100 people in the meeting, which is really great to see so many people engaged. So thanks to all of you for attending. The objectives of this webinar I mentioned briefly, but it's really showcasing existing collaborations between CBM, IFRC, and national societies, and the four that I mentioned, but also hearing a bit about global collaborations and very much exploring these possibilities for future collaborations. So apart from the four where there's already an active existing collaboration, there's those on the screen where there is a CBM presence and there's a real potential to do more. There's also the countries where CBM doesn't have a country office, but it partners with a local partner, and there's a potential there as well. The other objective, though, of the webinar, apart from clearly this focus on CBM IFRC, is getting some inspiration, some lessons about the potential for collaboration between national societies, disability-focused, disability-led organizations, also called OPDs, organizations of persons with disabilities, and more broadly, how to integrate disability inclusion in humanitarian work and how we can move that forward collectively as members of the humanitarian and disability movement. So the speakers, just before I hand over to Sander to maybe share a few thoughts before we get started. As I say, we're going to hear from Australia. We have Anastasia and Karen, from Bangladesh with Fazan and Shajat, from Nepal with Anit and Bimal, and then from Kenya with Wilson and Kevin. So thanks so much to our presenters. And if you haven't already done so, please do put your name and location and organization in the chat. That would be great. Sander, let me hand over to you just for a few brief thoughts before we start with our presentations.
Thank you so much, Stephen. A good day to everyone. My name is Sander Schot. I am based in the Netherlands, working with CBM Global. I have white hair, I'm wearing glasses, and I'm the Senior Inclusion Advisor and also work on institutional funding with CBM Global. What brings us here, or Stephen already said that we are really exploring collaboration between CBM Global and the IFRC and the national societies. Just a very quick introduction on CBM Global. What characterizes CBM Global is how we integrate technical expertise with partnerships, with authentic partnerships. We work on mental health, we work on eye health, we build economic resilience in climate-affected regions, and also we work on influencing global policies and disability rights. What I think is very special about CBM Global is that we really value working with the disability movement, not just for it. Our approach is holistic, really grounded in rights and co-created at every level. One of the special areas we also work on is really on disaster risk management, and also the humanitarian aspect of it also comes back very strongly. One of the ways how we work is in field programs in countries where we work. We work in 12 countries, and some of the collaboration we will also present here. We also work a lot on advocacy at levels from New York up to ground level. And then one of the other ways of how we work is through the Inclusion Advisory Group. And I want to say a little bit more about that. The Inclusion Advisory Group is a global network of disability inclusion advisors that are spread across the globe. We can actually source in their expertise when it is needed on demand. We provide tailored advice, not only to organizations like the IFRC, but also to UN agencies, to development banks, to INGOs. And
we lost you for a second there, Sander. Okay, that's unfortunate. You can still hear me, right, everybody? Ah, yes, you're back, Sander. Go ahead. We lost you for a second.
Good. Yeah. Thank you. And also some capacity development that we offer. So if you're interested in technical advice on disability inclusion, really on a very targeted basis. You can also approach the Inclusion Advisory Group as a vehicle within the CBM Global. You can also look at the website inclusionadvisorygroup.org, and then you can also find more information about what the Inclusion Advisory Group is. I'm handing back to Stephen again. This is a bit of a backdrop of what CBM Global is and where we work, but we'll go more in depth about the different collaborations that we have been having with the IFRC in the different countries.
Great, thank you so much, Sander. That's really helpful for those who may be a bit less aware of CBM. I won't do the same kind of introduction for IFRC. I think many of you, of course, all the national societies and IFRC people knowing it will know it well. Many will be aware, I think, generally of the main directions of IFRC and its strategies and long history. So I think we'll really hear, from the examples that we hear today from the 4 countries, the essence of the work that we're trying to do on disability inclusion. But just to maybe say that this is one part of our strategy to really improve and increase and deepen and go further on our disability inclusion work that we've been doing, of course, for over 100 years, but wanting to keep that fresh and relevant and active, and particularly collaborating with the disability movement in general. That's a nice segue to then ask our first speakers to take the floor. So I'm just going to ask Anastasia and Karen to get ready, and I'm going to spotlight the both of you to take the floor, and I'll share the presentation for you. So here's Anastasia, and let me find Karen. Karen, Anastasia, you're speaking first, right?
Karen will be opening, and I'll be doing the final 2 slides. Right. I will just ask when we get to the final 2 slides, if you can tell me when you get to when you switch to the slides. I can't see any of the slides because of the my technical difficulties, but I will let Karen start.
All right, over to you then, Karen.
Thanks. Hi, everybody. Hope you can all hear me okay. My name's Karen Alexander. I'm a Principal Advisor in the Inclusion Advisory Group for CBM here in Australia. Well, not here in Australia, but I'm currently in New Zealand. So it's evening my time. Really nice to see you all and be with you all. I am a middle-aged woman with light brown hair, glasses, and I'm wearing a blue top. And apologies for my lighting. I hope it's okay. I'm sort of not in my usual setup today. So, all right. I'll just move forward. CBM Australia has actually had quite a bit of history with the Australian Red Cross. So there's a little bit on the slide that you can see. Oh, sorry, actually, if you can move it to the history slide. A little bit of a timeline there of some of the previous interactions that we've had and the work that we've done together. Just for those of you who need me to read it out, on the slide is a bit of a timeline, sort of going from 2012 to 2017. I actually joined CBM Australia in 2018, so this is before my time. But I understand that in 2013 there was an Australia Awards Leadership Fellowship. That's the Australian government's funding, and that particularly targets people in low and middle income countries to come to Australia and study. And so there was some Red Cross National Society leaders who were trained on disability inclusive development and helped to develop action plans. Then in 2015, CBM advisors supported disability inclusion following the Typhoon Haiyan response in the Philippines, and also in Myanmar on an inclusive community health program with Red Cross national societies there. And then later on, CBM supported the Australian Red Cross more at home in Australia to integrate disability inclusion into IFRC's protection, gender and inclusion minimum standards, and develop the ARC disability inclusion policy. And yeah, so that's kind of a little bit of a summary of the history. And then more recently, and this is for both my time and Anastasia's, in December last year, there was an earthquake in Vanuatu, and it was a trigger. It was severe enough to trigger an Australian government response. CBM had been working on a program trialing assistive products, for example, wheelchairs, crutches, hearing aids, etc., going to be deployed with the Australian government's other relief supplies. And they hadn't actually, so it had been a kind of a pilot program where we were sensitizing and socializing that these products were available and that they could be deployed in a humanitarian and emergency, but this was the first time that they were actually deployed. So DFAT worked with the Australian Red Cross, and that's actually when Anastasia and I first met. And we coordinated to make sure that those products got to Vanuatu and were distributed to people with disabilities who may have lost or had their assistive products damaged, or, as is quite common in the Pacific, had never actually had the AT that they needed to start with. So that was a small engagement, but that really built relationships, and it really helped the Vanuatu Red Cross Society build their awareness on disability inclusion and link them up with the organisation for persons with disabilities in Vanuatu and the kind of main service provider there. So yeah, I'm going to hand over to Anastasia for a couple more points. Thank you.
Hello everyone. I'm Anastasia. I am the PGI specialist for Australian Red Cross. I am a middle-aged woman with brown hair and glasses, wearing a grey top. And I am also sorry for my lighting.
Actually, we can't see your video, Anastasia.
Okay, well, I can't see anyone else's face either, so I'm really sorry. It's just not working today. I'm very sorry, but that is what I look like. So thank you so much, Karen, for the great introduction and kind of how we've come together. I'm going to focus more on how we're planning to work together in the future. So from this first kind of past exchanges, we've realized that you can start your journey together and then build upon it. So me and Karen, having met and come together, have now met in different ways and looked at other opportunities in the ways we want to work, particularly strategically within the Pacific. So I'll be focusing on two current areas of collaboration that we're looking at, which is knowledge exchange and disability data collection, and then look at some of the other future collaboration packages. So these are practical forward-looking steps that we think will help national societies move from more isolated examples of inclusion to consistent and systematic practice. So the first is knowledge exchange. So we recognize that CBM brings decades of technical expertise in disability and rights, while the national societies bring their unique reach with their thousands of volunteers embedded in communities. So by connecting the two, we're hoping we can, one, build the capacity of national societies on disability rights and inclusive approaches. Two, involve Red Cross staff and volunteers directly in disability data collection, not just as an isolated exercise, but embedded into disaster preparedness and wider community resilience activities. And three, strengthen the loop between data awareness and action so that volunteers are not just collecting information, but also understanding how it feeds into service provisions and advocacy. So we see this as being a mutual benefit, as CBM will be strengthening the technical sides and the national societies will be able to provide that local reach and trust to make the data meaningful. Regarding particularly on disability data, we're aiming to pilot what is called the Humanitarian Disability Needs Assessment Tool, or HDNEST, which is created by the Nossel Institute. and it's a different way of collecting disability data in humanitarian systems. So it's much more rapid than the Washington Group question. So it provides another methodology for collecting data. So we want to look at, we want to be able to trial it as part of kind of a joint needs assessment, ensuring disability data is consistently included when crisis strikes. So what's important about the tool itself, not only the tool set, but it's the way that it will bring national societies, OPDs, and humanitarian partners into one process. We're hoping it will produce quick, usable data that supports decision-making in the first days of a response. And we want to create a model that can be shared across the Pacific, adapted and scaled. So our aim in the beginning is to start small in one targeted Pacific location, but the ambition hopefully will be regional, building a collective way of working that makes disability data part of the standard humanitarian practice in the Pacific. Next slide, please. Then looking forward, our collaboration package begins to build on these foundations, we hope. So together, we're hoping to strengthen the capacity and leadership in national societies through training, rosters, and inclusive simulations. Deepen partnerships and networks with OPDs and service providers, so isolation is rooted in local expertise. Advance safeguarding and accountability, aligning frameworks and making referral pathways truly accessible, and mobilize resources and advocacies so that we can have locally led disability inclusive programming. So we're hoping that this will take us from pilots and projects to a longer term system where inclusion is embedded. To sum up, I guess, CBM and ARC are not just trialing tools. We're trying to build a system of knowledge exchange and joint data collection that can transform how the Pacific responds to crises. We really want to grow on our 4 pillars of our collaboration package so we can ensure that disability is not just a side activity, but a core part of our humanitarian action. And we hope together with the national societies and OPDs in the lead, we'll have a chance to model what is inclusive, locally driven response really looks like. Thank you.
Well, thank you so much to Karen and Anastasia. That's a wonderfully concise and very fascinating example of a number of different collaborations, and really loving this idea of having a piloting approach where you can trial out a few things and then trying to make it broader and wider, and that seems like a wonderful way to go. So thank you so much for those points. Very helpful. Of course, we'll share all these slides after the webinar. If you do have questions or comments for any of the presenters, please put them in the chat for now. We'll keep a track of that. I see Carmen's putting a question, and we will do our best to have some time to come back to that at the end, as long as we all keep to our presentation time, which is always a bit of a challenge, but let's see how we do. And with that, I would then ask for our Bangladeshi colleagues to take the floor. So that's Farzana Akhtar from Bangladesh Red Crescent and Shajat Hossain from CBM Bangladesh. Who's going to speak first?
Farzana.
It's Farzana. Okay, great. All right. Okay, well, thank you very much. I'll get your presentation up for you as you get started.
Okay, thank you so much, Stephen. And Assalamu alaikum and good afternoon, everyone. I am Farzana Akhtar, working as Assistant Director and PGI Focal, Bangladesh Red Crescent Society. Today, we are Team Bangladesh Red Crescent Society, IFRC, and CBM Global. Delighted to share with you the story of collaboration between CBM Global, the Bangladesh Red Crescent Society, and IFRC. In this short session, we look at 3 things. First, why collaboration on disability inclusion is so valuable to scale up inclusive approaches in their own context. Second, the achievements and mutual benefits from our past and existing collaboration. And third, the way forward. So, Stephen, thank you so much. When the Rohingya crisis began in 2017, Bangladesh faced one of the world's largest humanitarian challenges. Hundreds of thousands fled to Cox's Bazar and health services were overwhelmed. Among the most affected were people with disabilities, and many had never before access to rehabilitation or psychosocial support. Assessments revealed that more than half had unmet needs for assistive technology. The reality made one thing very clear: unless we work together, people with disabilities risk being left behind in humanitarian response. So collaboration was not optional, it was essential. And assessment revealed that more than half had unmet needs for assistive technology. May I have the next slide? Yes. To respond, CBM Global and the Center for Disability in Development, let's see, CDD, partnered with the Bangladesh Red Crescent Society. We piloted an integrated model at the VDRCS Field Hospital and Primary Health Post in Camp 13 in Cox's Bazar districts. Rehabilitation services were placed alongside primary health care, creating a true multidisciplinary team of doctors and rehabilitation therapists working together. The impact was powerful. Initially, referrals to rehab were few, but once doctors saw how patients improved, referrals tripled. Patients recovered faster with greater dignity, and the hospital became more accessible for persons with disabilities. And one BDRCS doctor said having both medical and rehabilitative care at the same time allows the patient to recover faster. So now I am requesting Sajjad Bhai from CBM Global Bangladesh part for new views, our next views. Thank you from my side.
Thank you very much, Farjana Apu, and thank you everyone. Good morning, good afternoon, and good evening. This is Sajjad. I am working with CBM Global Disability Inclusion Bangladesh Country Office. I am the program leading for DI-DRM section, DRR, climate change, resilience, livelihood, and humanitarian. We have a very good journey with Bangladesh Red Crescent Society, including IFRC. I think not only for humanitarian, like we have the anticipatory action, jointly also doing, and also inclusive early warning in our development program. But now I'm just discussing about our humanitarian partnership program with the BDRCSS. We have the live agreement with the Bangladesh State Christian Societies still 31st December 2025. It was like a 5 years journey with BDRCSS under this Rohingya response program. So now I'm just going to discuss about some lesson learned and way forward. Two slide I can also explain like 5-6 minutes. So thank you very much again advance for your passions. So we have started our journey with the BDRCS through our implementing partner CDD. CDD is our the long-lasting partner, around 27 years partnership with the Center for Disability in Development. We are also working together and working with the BDRCS and IFRCs. So now I shall share the lesson learned and benefit this partnership for the Rohingya response. As we reflect in our journey, we also discuss jointly with the BDRCs. Then we decide like a fourth, the lesson learned we can also discuss in this webinar. Then firstly, we have seen the integrated care significantly improve the recovery for the people with disabilities through our collaboration with the Bangladesh Red Crescent Societies and CBM Global. We have combined the health rehabilitation and the capacity building outreach health worker. This holistic approach not only restore the dignity and the independence, but also ensure that services are inclusive, coordinated, and accessible, especially during the humanitarian recovery and disaster recovery. Secondly, we are also thinking about the outreach model has proven the essential expanding the access to service the Rohingya camps and disaster affected and humanitarian affected areas. By delivering the rehabilitation, healthcare, and capacity building support directly to the people who have overcome the physically and socially barrier, build trust, and empower the communities. This model strengthens local network and creates a sustainable pathway to inclusions. Thirdly, we are also thinking about the lesson learned could be the capacity building for the staff, volunteers, and caregivers has been a transformative joint training initiatives led by the Bangladesh Red Crescent Societies and CBM have gone beyond the technical skills. They have fostered the empathy, challenged the stereotypes, and embedded the inclusive practice across the all level of responses. This has strengthened community resilience and created a culture of inclusion from the group up. And finally, our experience shows that collaboration between CBM technical expertise and Bangladesh Red Crescent Society, including the IFRC's grassroots, create a scalable, impactful model. CBM provide the tools, training, guidance, while BDRCS and IFRC mobilize their vast volunteer networks to deliver the inclusive service where they are needed most. This synergy ensures that no one left behind, even in that most remote and vulnerable communities in the Rohingya and also humanitarian context. Together, these learning are not just the lessons, they are also proving the practice that demonstrate how to inclusive humanitarian action can be both effective and equitable when built on the strong partnership, community engagement, and the shared commitment to the dignity for all. I think we are also discuss about the how can we move forward regarding our lesson learned and our engagement, because our just agreement will be in by this 31st December 2025. As we look ahead, one message is clear. Inclusion is not just a value. It's a commitment of dignity, strength, and hope, all for all. Our journey with the Bangladesh Red Crescent Societies and CBM Global has shown that when we combine community reach with the technical expertise, we can move from the isolated effort to systematic lasting changes. I make this vision is the really we must act on the several fronts. Mobile rehabilitation camps and mentoring bring service directly to people, especially in the remote and disaster-affected areas. They break down barriers, build trust, and empower community through the hands-on support and local capacity building. So we are also thinking another way, the leading by the example in essential when organizations like BDRCSS and CBM model inclusive practice through accessible service, diverse teams, and meaningful participation. We inspire others to follow and embedded inclusion in their own work. And continuous skill development ensure our teams remain responsive and confident in innovative. Ongoing learning strengthening our ability to adopt and deliver the inclusive service that meet evolving the needs. Leveraging the technology. This is also now is a very much craze in this humanitarian action also, section also, allows us to reach further and respond the faster from tele-rehabilitation to accessible digital platform. Teach help us to expand access, personalize support, and improve coordination. That was also we experienced in during the COVID. And finally, mainstreaming the rehabilitation into Bangladesh healthcare system is critical. By aligning with the WHO guidelines and supporting the government efforts, we can ensure rehabilitation is not a luxury, but a core part of the universal health coverage. Together, these strategies for a roadmap for inclusive, resilient, and equitable humanitarian development system. Let's move forward with the purpose so that inclusion becomes a standard, not expectation, and no one left behind. Thank you, everyone. Thank you, Stephen, and for also listening my two slide very briefly. Thank you very much, Stephen. Over to you.
Shukriya, thank you so much, Farzana and Shajat. A really equally fascinating presentation, and I put in the chat already for those, if you didn't see it already, there's a link on our website to the case studies that are being presented here. So for more information, please go to that link and have a look through. And so many interesting things to see there, and do put your questions and comments in the chat, but interesting to see a kind of a theme of starting with some very specific interventions and some working on some really very concrete ways to collaborate together, and then expanding from that to a broader, more inclusive approach throughout the health system, throughout the humanitarian response. And would just mention very briefly that within IFRC Bangladesh as well, I mean, as support of and facilitating Bangladesh for a Crescent Society, this kind of support is becoming systematized in the emergency response. So with CBM and Center for Disability and Development, to really bring that expertise into all emergency response. More information about that also on the website. So thank you again to our Bangladesh colleagues. I now would then ask for Anita and Bimal from Nepal to take the floor. I will share your presentation and hand over to you. Let me just...
Thank you so much, Stephen. I'm sure you will be sharing my slide.
Yes. I'm just going to add you to the spotlight, Bimal. Namaste.
Yeah. Namaste and good morning, good afternoon, and or good evening, everyone. This is Bimal Paudel. I'm working as Disability Inclusion Advisor for CBM Global IAG team based in Kathmandu, and I do have my colleague Anita Adhikari from Nepal Red Cross Society. In the very first slide, I do have one picture that was taken during the FCD in last assessment of DIDRR tools in Lamjung district, where 12 women are seen, and one of the OPD leaders, women, is leading that particular FCD, and the discussion is going on. And I do have some of the logos. It means we collaborated very jointly, like IFRC, FRC, Nepal Red Cross Society, and Abilis Foundation, and definitely the CBM Global IAC group. Next slide, please. Since Sander had a little bit tossed about the three vehicles of change, that I would mostly highlight how we work as a CBM in Nepal, particularly at country level. We do have three vehicles of change. For instance, we do have around long-term 18 long-term partnership, of which more than 45% are OPDs, organizations of persons with disabilities, and we are now present more than in 38 districts in Nepal. And for advocacy, particularly, we support organizations of persons with disability like NFDN, National Federation of Disabled Nepal, Nepal Women, Disabled Women Association, and some others to unite as well as amplify their voices. And as another vehicles of change, as an advisory support, we provide very specific and targeted advisory supports to different organizations. In last 5-6 years, we have been able to support different UN agencies, including UNICEF, UNFPA, WFP Nepal, UNRCO, and some other international organizations like LWF, Mercy Corps, including IFRC in Nepal. And for that is my diagram shows the disability rights movement is at the center, and we're accountable for the disability rights movement as well. Next slide, please. And particularly with IFRC and its national societies, what we for last 1 year, we have been collaborating particularly through our the vehicle of change called advisory support, that we provided very specific technical support engaging multiple stakeholders. For instance, we jointly reviewed and revised some of the very key TIDRR tools that the Nepal Red Cross is using in the field. For instance, we produced some of the deliverables which are not only useful for Nepal Red Cross, but beyond the country as well. For instance, the assessment report that we produced, particularly from with the field insights to have the better approach and tools for future improvements as well. And definitely the checklist for accessible and participatory events or meetings, including vulnerability capacity assessment process as well. And disability specific training manual that we produce for at least 4 hours, so that this kind of sessions can be integrated to wider level of Red Cross different training manuals as well. Here I do have one picture where 9 males and 2 females are in close circle in chairs. They are discussing. Actually, this photo was also taken during the field process in Lamjung district. Next slide, please. And what we learned, what we did and what we learned particularly from this project is an OPD engagement is ensured right from the beginning, from very beginning of the inception to the revision and upgrading of DIDRR tools that we engaged. As you also had seen, one of the OPD members was leading the FGD, and not only for the field programming, field assessment, but also to revise those DIDRR tools from OPD's perspective as well. And definitely as we invited the participants to different centers, since some of them were unable to come to the points, that's why we felt to visiting to their doorsteps, even capture their voices. For instance, those people with complex and profound disabilities as well, so that their voice was also heard during the assessment. And definitely since a few of the deaf people were not using the standard Nepali Sign Language, that's why we used some of their relatives and close friends.
I think we lost Bimal. We'll try to get Bimal back. But Anita, do you want to maybe pick up from there whilst we see what happened to Bimal? Maybe the lost power.
Okay. Namaste and good afternoon, everyone. I'm Anita from Nepal Red Cross Society, working as a program coordinator in JC department. What Bimal is explaining here is that what we discussed in the field level, like to whom we met and to whom we did the FGT and KII in the field level, like OPD engagement, home visits, and the separate discussion for men and women to take the real scenario from the project. And these things he was expressing here. And I want to continue from the next slide. So, okay, as Bimal sir was explaining about the tools and what we updated and developed. So at first, to begin with this, I would like to express my sincere gratitude to Bimal sir for outlining the background and the key initiatives regarding the collaboration between Nepal Red Cross and CBM. here I want to go through the point like how useful was the collaboration and tools for NRCS, and that is the tools. The two tools we were developed, like one is the specific training package and another one is checklist, so that these tools have enhanced the confidence level of our staff and volunteers in engaging persons with disabilities in different events like training, orientation, workshop, vulnerability capacity assessment in a participatory and a meaningful way. And the next is he was also explaining about the assessment report. After reviewing this assessment report about the using of tools in the field level, NRCS and our partner organization now is agreed to use for the wider use of these DIDRR tools and approaches in future. And the next part is about disability inclusion checklist. In the whole process of developing and finalizing this checklist, Nepal Red Cross Society, the representative from Danish Red Cross Country Office Nepal, and the representative from Finnish Red Cross Country Office Nepal, and the Finnish Red Cross headquarters was fully engaged from the beginning to the end to develop, to prepare and the finalizing of this checklist. And another one is the disability specific training package. Here I want to share that this disability specific training package is not totally new for Nepal Red Cross Society, because Nepal Red Cross Society has already implemented the standalone project for disability inclusion in earlier. So we developed such type of package previously and also piloted in the field level. But this time we also reviewed this package jointly with CBM and found that we have to, it is needed to update some of the things in this training package, so that this time with the technical support of CBM, we updated this disability specific training package as well. And on behalf of Nepal Red Cross Society, now I proudly say that by explaining this point, now Nepal Red Cross Society has updated practical ready-to-use tools for inclusive event management and training. Next slide, please. Okay. Just the development of the tools is not the important things, but how we use these tools in future is the important part. So that Nepal Red Cross Society is planned to use these tools in future in various ways, like integration into project, that Nepal Red Cross Society is planned to integrate these tools into all department projects and program to enhance accessibility and participation. And another one is staff training, like Nepal Red Cross Society is planned to train our staff and volunteers on this updated disability specific training package, so that our volunteers will be ensured these inclusive practices and applied this consistently in the field level in each programs and project. And the next one is event planning. Now we have the disability inclusive event checklist, so that while planning any event like a meeting, workshop, BCA, etc., this disability inclusive checklist will be our guide for every event planning. And we also plan to use this checklist in the field operations level, like in monitoring, and not only use the checklist in the field level, but we also plan to track the effectiveness of the tools, how effective it is in the field level after testing, so that this is also one of our plan to use the tools in future. And last but not the least, knowledge sharing is also one of the important part. Beyond our internal use, we are planning to wider disseminate these tools across the departments and our other partner organizations to promote inclusive approaches throughout the humanitarian work. In conclusion, these tools mark an important step in strengthening our institutional capacity and ensuring that disaster risk reduction efforts are accessible, participatory, and truly inclusive of persons with disability. Thank you very much for your attention. Thank you.
Anita, thank you so much, and thank you to all the speakers. I will see Bimal has joined us back, had a brief disconnection problem. We are a little bit behind time, as is always the case. Speakers, thank you so much for doing a wonderful work of getting through a lot of content very quickly. We, though, do need to keep going. But Bimal, did you want to just have some closing remarks before we go to Kenya Red Cross and Kenya CBM?
Yeah, thank you so much. Sorry for this technical problem. Only the thing is the proper planning that I would highlight here that I wanted to share. For instance, we timely plan and even appropriately provision the even cost for the reasonable accommodation and other accessibility requirements as well, even during this project, then definitely we can be successful. And another thing is just to add on the things shared by Anita ma'ams, that we are also planning to have one brainstorming session even at country level as well with IFRC and Nepal Red Cross Society, so that we can strengthen and foster the further collaboration in days ahead as well. Thank you.
Wonderful. Thank you so much then to Bimal and Anita. And as ever, please do put comments, questions in the chat, and we can respond as we discuss and hopefully have some time for a little bit of discussion at the end. Again, another great example of really focusing on a few key areas of the strength of CBM's technical expertise, the reach of Nepal Red Cross Society, and I think we really see the benefits of that. And as you might see in the chat, with the support of Finnish Red Cross, so a very nice example of collaboration between a few partners. With that, another great example, and we've had, some of you may have heard some of these presentations from Kenya Red Cross before. We've had the great pleasure of having Wilson and Kevin demonstrating some of the ways that the Kenya Red Cross has been focusing on disability inclusion, but now we're going to have a bit of a deep dive into the collaboration of the past more than a decade. So Wilson, you're going first? Or Kevin? Go ahead.
So thank you very much. My name is Wilson Owino Pudo. I work for Kenya Red Cross. I'm currently the PGI focal person. I'll go first, and please, Stephen, kindly allow me to share my screen, even as Kevin introduces himself. Yeah, thank you.
Yeah.
Good morning, everyone. My name is Kevin Sudi. I'm the country program manager for CBM Global, based here in Nairobi, Kenya. Over back to you, Wilson.
Okay, thank you very much. I just want to start by saying that based on our experience and learnings, Kenya Red Cross and CBM Global have been working together since 2011. And our main purpose has been to make sure that the humanitarian response is more inclusive, especially with intersectionalities around climate action and resilience. And this is because historically, we've had persons with disability being excluded due to the inaccessible program designs, as well as non-inclusive data sets, and also experience around limited consultations with OPDs. And therefore, looking at what we've been able to achieve together, I'll quickly take us through whom we've been able to support and the how. And just quickly, to mention is that we've been implementing a project on inclusive climate change and resilience in one of our counties, one of the 47 counties in Kenya, called Bungoma. And here we've been able to support persons with disability across the various sub-counties. We also worked... Hello? Please confirm if you can hear me.
Yeah, we can hear you. It's
thank
just
you.
somebody that was unmuted. We can't see your screen yet, though. If you're presenting the slides, it's just blank.
Okay, are you able to see me now? My camera is actually on.
No, can see you, but not the presentation. So should I maybe share instead?
It's okay. Fine. Can just share. Let me stop sharing. Then
there we go. I think that's okay now, right, Sander? We can see.
Right.
Yeah.
Fine.
Okay. Go ahead. Just tell me when to click.
Okay. Yeah. So as I had mentioned earlier, we've been working with persons with disability as well as OPD advocates and also volunteers and decision makers. And most of these decision makers actually entailed working with the county government leadership, as well as the line ministries. This includes the gender sector working groups, the Ministry of Health, and also the National Council of Persons with Disability. Aside from that, we've been able to support with trainings for the Kenya Red Cross staff, just to be able to make sure that there's the element of integration of inclusion. Probably just before I move on to the next slide, Stephen, from my end, I'm not able to see the slide. Could you please, if possible?
Okay. Was supported and how? Yeah.
Okay. So as I mentioned earlier, we are excluded from humanitarian processes, and also we've been able to address key challenges limiting persons with disability to be able to access aid. We also made sure that we focused on relationship building, especially with the OPDs and also the communities within the project area of implementation. Capacity building was top of on our priority, and through this, we were able to train and also make sure that at least to establish disability inclusion champions across the 8 regions within Kenya, and also seek support from the advocacy teams, which mainly consisted of the county chairs of persons with disability, or for lack of a better word, OPD focal points. Co-creation was also on top of our list, and this is because we wanted to co-create solutions with meaningful involvement of persons with disability, and through this we were able to also map out organizations of persons with disability, and also made sure that we had targeted outreaches, basically while working with the other stakeholders whom I had actually mentioned earlier. Through this, and also the Association of Persons of Disabled of Kenya, again APDK, we were able to also support with assistive devices and also register for identity, because again, one of the key barriers is with regards to access. So we were able to mobilize and register all these persons with disability to be able to actually get identity and also formulate or establish OPDs that were supported through VSLA startup kits. Now, how did success look like? For success, we were able to achieve this success at 2 levels. One, we had the institutional level as well as the community level impact. But again, before that, we had to overcome quite a number of barriers. Key amongst them was with regards to limited engagement of OPDs. We realized that we only used to engage these OPDs when it was too late, especially only at the crisis stage, and also persons with disability being treated as homogeneous groups. while also ignoring their diverse capacities. Aside from that, this was coupled also with low inclusion awareness, especially within the community, and also lack of a structured format of operations, especially for the OPDs. So with that, we were able to actually realize that, again, for us to overcome this was, one, to make sure that we build OPD relationships, not only at time of crisis, but also during peaceful times, so that we will be able to build trust with these particular OPDs. And through that, we've been able to realize that at least over 8,000 plus persons with disability have been registered with National Council of Persons with Disability, and at least they now have entitlements. Aside from that, again, we were able to also make sure that we appoint advisors and also train staff, and through the regional disability inclusion committees that were actually established. In terms of our data collection tools, again, this is something that was achieved to make sure that we capture diverse disability typologies. And this is something that, again, has been embedded into our Kenya Red Cross policy through the support from CBM and this partnership. We also made sure that there was tailored outreach access, and that included adapting programs that were fully inclusive. Resource allocation is also one of our key achievements. At least now we've been able to make sure that in all our project designs, we have some funding allocation for reasonable accommodation. Last but not least, we also learned that the government and OPD engagement is quite very important, and this is because of their support role in terms of policy implementation as well as risk reduction. To overcome both the attitudinal and the structural barriers, we've also made sure that at least we have a representation of persons with disability in leadership positions, so that at least their voices can be heard. Lastly, is to mention that we've learned a lot from this particular partnership, especially in Bungoma County, and we are learning that it is good for us to, moving forward, continue engaging and scale up the engagement of organizations of persons with disability, so that no one can be left behind. And aside from that, we are also learning that it's also good to create awareness around inclusive practices, so that we can be able to build resilient and disability inclusive humanitarian ecosystems. I think up to that point, I'll want to hand it back over to my colleague, Kevin, to just give in his inputs. Thank you, and back over to you.
Thank you very much, Wilson. Just to summarize, what we are learning is the relationship between the Kenya Red Cross and CBM Global in Kenya works essentially because we have a partnership that is based on mutuality and complementarity. Both organizations are really strong on shifting power and putting more decision-making in the hands of our communities, our OPD groups, and they are leading in implementation of our projects, both in development and in humanitarian work. We are also sharing core value of inclusion and inclusivity. This is clear between Red Cross and CBM Global, and that's we ensure that we are inclusive in all our processes, our projects, and our engagements seek to elevate inclusion, even to transfer this to the other stakeholders. And lastly, that we are both learning organizations. We've been able to undertake studies to institutionalize inclusion and collaborate on generating evidence and data to support greater work. So our partnerships around these areas will keep ensuring that the collaboration does not stop at project implementation, but rather generates information that can inform other stakeholders in the sectors of development and humanitarian issues. Thank you so much, and back to you, Stephen.
Wonderful. Thank you so much, Kevin and Wilson, for that very insightful, again, demonstration of this collaboration. And we really get a sense that the collaboration has grown and developed over the years, and there's a real good understanding between the two organizations. And I think that was very helpful for Kenya Red Cross, at least in developing this very comprehensive strategy on disability inclusion that we've heard about from Wilson before, and is available on our website for some demonstrations of that. And thank you for being so concise and so brief. That gives us some time to come to the rest of the group for questions and comments. And I do see there's been a number of comments and questions coming in the chat, but this would be an opportunity now for anybody to to take the floor to maybe share some thoughts. We do have a few questions that we wanted to look at as well, in addition to questions for the presenters. But Sander, please go ahead.
Yeah, thank you, Stephen. I think there are two main topics that people addressed in the chat. First of all, the one around the disability data has been a bit of a side discussion in the chat. So I think it's good to give the people the floor to ask the question and also to discuss a little bit about disability data and what kind of tools to use. And then the second is about, is there a standardized disability assessment tool for use in the Red Cross movement? So
yes, indeed.
Actually also around tool development. So those are the two topics that came out in the chat so far. Over to you.
Great, thanks so much. On the disability data and similarly on the assessment tool, I'll just put a link in the chat here to the main page that we have on the PGI Hub. It's links to the key resources that we have on that are included within our PGI minimum standards and PGI toolkit, which are good basic tools which would be useful for IFRC operations, National Society operations. Having said that, they are also complemented very much by the tools of humanity and inclusion, who were mentioned earlier. They're really one of the leaders in that area in the disability space, and we've collaborated with them in the past. And so there's links to the very well-developed and useful tools that they have, as there's no need to reinvent the wheel too much. At the same time, what we do have in the minimum standards is trying to make that concise and usable for national societies. But yeah, maybe I know it was Carmen, you had a question about psychosocial disabilities and assessment on that. Did you want to say anything further?
Thank you, Stephen. And hello, my name is Carmen. My pronouns are she, her, and I'm a middle-aged woman, brown hair. I'm wearing glasses, and I'm in one of those mute poses with not great light, so sorry about that. Yeah, I think it's actually been really nicely answered in the chat, and I think it's maybe the reflection is that some of these tools that have been, like the Washington questionnaire, that have been very focused on identifying specific disabilities can sometimes be very tricky to use in a humanitarian setting and with all of the constraints. And I found very interesting the tool, the HD Nest, with the link in the chat, because it's so concise and it's kind of like overarching. It seems to identify needs of all sorts. So I guess the reflection is then if we've had specific interest in identifying persons with psychosocial disabilities is on the eyes of the person using the tool, to also make sure that you're double checking that any of those needs, daily support or any other assistant devices, also includes psychiatric medication. Do you need support for any mental health concern? So very useful to see that there's something more general that can cover all disabilities. And it was very nicely responded in the chat. If anybody wants to add, please go ahead.
Thanks for that, Carmen. And indeed, yeah, and thanks to Anastasia for having highlighted that. I mean, it is those who know the Washington group questions will know that they are as simple as they are. In some contexts, they're not simple enough for some purposes, and it needs maybe a bridging step of those simple three questions that Anastasia pointed out. I did want to have a little bit of time, though, if we can, for the question on other national societies and CBM countries who are perhaps in the call, who know that there's a potential for collaboration but haven't done it yet, and not to put anybody on the spot or kind of sign a cooperation agreement on the spur of the moment. But those countries that we mentioned earlier, where there are CBM presence. And is there somebody from those countries who might want to share some thoughts, ask some questions about what they've heard, and or any questions to Sander or myself about how collaborations could be started or developed further? So we're thinking of Indonesia, Laos, Bolivia, Madagascar, Philippines, Nigeria, Papua New Guinea, Burkina Faso, Zimbabwe in particular, as well as Fiji and Solomon Islands, Vanuatu and Vietnam. So if anyone is from those countries and would like to take the floor, please do. Otherwise, other questions for presenters, other comments, other reflections on what you've heard? Tushar, please go ahead.
Thank you so much, Stefan. My name is Tushar Wali. I'm working with CBM Global as the Disaster Risk Management Director. Thank you so much for sharing all the examples. I did want to spotlight on an area of gap where we are quite keen to explore collaboration. That's around cash and voucher programming in humanitarian assistance. So we have done quite a bit of work in kind of documenting the learnings over the last 10 years, developing some research and some online trainings, but we would be keen on exploring research opportunities to really bring out evidence around good programming aspects. And in conversations with Sander, we were trying to explore appropriate places where we could build on existing relations and work. And obviously, Kenya comes across as a good place to explore that. So would be keen to hear from colleagues if that's an area of interest, if we can progress that forward together. And I'm happy to share in the chat some resources that might be useful to reflect. Thank you.
Great, thanks very much. I'll respond to that, and there may be other colleagues in the call. I can't see everybody who's here working on cash at IFRC or in national societies. But Suleiman, did you want to maybe share your question, comment first? Yeah.
Greetings to you all. Good morning, good afternoon, good evening, wherever you are. I'm Sulaiman Abdul Mumini Uja. I'm a sign language user, and I'm here with my sign language interpreter. I'm putting on a white t-shirt, a white shirt under, then a black jacket over it, and also a black cap with the CBM global logo, and a black glasses, and I have a I have a white background. Yeah, the presentation, the interaction was very good. And with respect to OPD collaboration, which is very key in any intervention or in the process of leaving no one behind. Now, what I notice is that IFRC work across different countries, and also Nigeria has its own Red Cross. But I don't know how you can make sure that the Red Cross Nigeria, their strategies of work or their intervention are inclusive of persons with disability. And sometimes early this year, I think around when a flood happened here in Nigeria, many interventions took place. And Red Cross Nigeria also make intervention, but they don't give priorities, they don't give consideration for persons with disability. So this is a call for question that how well are Red Cross being inclusive of persons with disability? And again, we understand that last year there was a lot of flooding here in Nigeria, and some emergency intervention happened, and a lot of INGOs, a lot of intervention were made, and NEMA, that's Nigerian Emergency Management Agency here in Nigeria, made a lot of intervention, and do not really prioritize persons with disability. And the question here is, how do IFRC and Red Cross learn across all these their partnership to make sure that they give priorities to persons with disability, and again using the best practices, using the humanitarian framework. So that's the question.
Great. Thanks so much for that question, Suleiman. Let me then come to both of those questions and offer some thoughts at least. So on cash, thanks Tusha for sharing that and sharing the resource. I don't think we have any cash colleagues on the call. Is there anybody who would like to take the floor and respond? In addition to what I would say, which is certainly we'd be very happy to look at that collaboration. I mean, you may know certainly cash and voucher response is a very significant aspect of the work that we do in IFRC and in many national societies. We have a dedicated cash hub. We have the cash toolkit and a lot of resources since more than a decade. And my colleague May is putting the link in the chat right now. We've been working closely, but not with the colleagues who are on this call, unfortunately, so they could say a bit more, but there's been a lot of work to look at generally how to make cash properly inclusive, looking at the gender and diversity aspects in general, and within that some disability aspects. So for sure, if that's would be a great area to look more into without knowing exactly how that would look right now, but the interest is very welcome and noted, and we could look at connecting you and other colleagues with our cash colleagues. So thanks very much for bringing that up. And then I see Fatih Nasir, you have your hand up. Please go ahead.
Thank you, Stephen, and thank you, everyone. Morning is morning here in Nigeria. I just want to respond to the last call, the question from Suleiman. Yes.
Super.
Suleiman, I don't know if you participate in Red Cross activities in Nigeria, because disability inclusion is one of the priority areas in all our interventions. So either in cash or non-monetary distribution, like non-food item or food item distribution or cash distribution, the first priority are people with disabilities. In every community, you can check that in our website. You can also contact or join, log into the Red Cross portal, the Nigerian Red Cross portal, to see some of the activities we've done so far with people with disability. It's just that the only challenge we have is having those different group of disability. And we realize that most of them, like 60% or 70% of people with disability, are not educated in Nigeria. So even when we developed materials for physical disability, for example, and people with the blind, we can only distribute few for those who actually can read it, but most of them cannot read because they can't make use of it. Then for sign language, every intervention you can find out, you are a Nigerian, I'm happy. For every intervention, we have people, we have experts that we engage in sign language, and we even have people with disability who are translators of sign language that also, they are part of Red Cross, they are Red Cross volunteers that also pass messages across the volunteers or people with disability. So please try to find out some of the things we do. We recently signed a partnership with the Office of the Personal Assistant and Special Assistant to Mr. President on disability inclusion. You can also find that out. It's on the net. Thank you.
Thank you so much, Fatima. I think you didn't introduce yourself. So I know who you are, but maybe you just could share who you are so that for other colleagues.
I didn't get that, Stephen.
I don't think you introduced your position in Nigeria Red Cross.
Okay, sorry.
Yeah.
I'm Fatima Nasser. I'm the Director of Protection, Gender and Inclusion plus Education.
Great. And thanks for sharing all of those points and perhaps be able to facilitate further collaboration with CBM Nigeria. Sounds like there's a lot of potential there. Great to hear about the advances happening in both organizations, and perhaps some of these types of collaboration we've been hearing about could be useful in Nigeria. So that's, which is great, because that was very much one of the ideas of this webinar, was to demonstrate the potential and see where there could be scope, and of course not to be directive about any collaborations. If it works at the country level, great. If it doesn't fit in for some reason, absolutely fine. It's really only if there's a benefit, mutual benefit, but sounds like could be at least some good discussions to have there. We have about 8 minutes left. And so if there are other questions, people who wanted to share just their reflections on what you've heard so far, you're very welcome to take the floor. Any other hands raised or any other things?
Stephen, there is a really
share?
interesting contribution from Carmen still about a collaboration also with Australia on mental health. I think that's worth mentioning. Maybe
Go ahead, Carmen. Do you want to share? Yeah. Mm-hmm.
Sure, thank you. I was waiting for others to take space as well. But yeah, it's really, really, really exciting. CBM Australia is supporting these projects. So maybe I'll go back. When it comes to access to mental health for persons with mental health conditions and psychosocial disabilities, of their human rights and access to the rights that the CRPD is protecting, we always encounter a lot of difficulties, and institutionalization is still so common. So quality rights is a very good tool from WHO, but one of the big challenges is that there's not a lot of trainers of quality rights. There's not a lot of people who can facilitate this tool. So CBM has taken on this big effort of having a good pool of trainers. So we are collaborating from here, from the MHPSS Hub, which is a movement-wide structure that provides MHPSS support to the entire movement. So we are collaborating in that project, in which we will be doing master training of trainers. So we'll train in trainers. They can then do TOT across Philippines and Fiji and Indonesia. And hopefully this will be just the beginning of this effort. WHO is very interested in having that pool of experts and trainees. And yeah, the collaboration is going on with finalizing the package, and hopefully in between now and the beginning of next year, we will be, or around April next year, we will be completing this first phase. It's a wonderful project, and thank you to the colleagues of CBM Australia and Global, because it's a great effort, I think.
Wonderful. Thank you so much, Carmen. Very interesting to hear about that, and would certainly be happy to hear more and work further on that. A great scope for collaboration. 5 minutes left, so I do have a few closing thoughts, but any last comments, suggestions? Yes, Vicky, go ahead. And then it'll be the last one, and then Sandra and I will just have a few thoughts to close.
Hi, Vicky Rollins. I head up Wellbeing, Health, Safety and Physical Security for Australia. And I was just interested, I think, Carmen, if we could maybe connect on that work, because I'm doing a lot of work in that area in Australia, and plus we have regulatory requirements as well. So if we could connect, I'd really appreciate that, to understand the work that you've been doing. Thank you.
Thank you so much. We can reach with Alicia and Sel, we said also in this call, Sel from Philippines. I think we can definitely do that. Thank you so much.
Thank you.
Great, wonderful. Well, we're coming towards the end, so I'll just once again thank you to all the speakers. We've been wonderful presentations, and as I mentioned, the case studies are on the website, so if you want to go into more details, those are there. We had a few connections potentially starting up there, and that's really wonderful, because that was very much one of the key aims. And I see Burkina Faso CBM is mentioning about the collaboration there was between Burkina Faso Red Cross and CBM, so a few other examples that we could share about. And as I say, this is really one part, a very significant part of IFRC's future strategy to develop our disability inclusion further, meaning supporting national societies to do more and better disability inclusion work, and to really capture the experiences that we see in national societies and make those links with OPDs and with disability-focused organizations, knowing that there's a lot of experience and knowledge knowledge in national societies, but not as much in most cases as there are in a dedicated disability-focused organization. So the type of using our own assessment tools is great, but using something like humanitarian inclusion tools who are really dedicated on disability data is a great opportunity. And I just wanted to pick up one other thing that Carmen mentioned actually around that project with a particular link to the Convention on the Rights of Persons with Disabilities. And at a broad scale, it's one of the founding platforms for this collaboration is the international humanitarian law, international disaster law, and the Convention on the Rights of Persons with Disabilities and other disability rights documentation, or legislation rather. And just as a reminder that in these kind of spaces where we have very specific international humanitarian and human rights law that's available, there's very much a scope to use that to inform the programming. The approach of our PGI approach in IFRC and of the movement is described as driven by needs and informed by rights. So there is very much a benefit to using those rights-driven documentation, those rights-informed treaties and conventions and legislations to support the needs-driven work that we do in Red Cross Red Crescent societies. So do encourage people to use that where it's useful. But all of that just to say that what of course is really at the heart of it is understanding each other, meeting, collaborating, and understanding where we can support each other. And Sander, maybe a few closing thoughts from you on what you've heard and how you think we could move forward.
Yeah, thank you so much, Stephen. I was really also impressed by the diversity of the different practices from 4 different countries that I think the collaboration grew very naturally and over a long period of time and deepened really. And I think that for me really stood out, how we can really complement each other, where Red Cross really has its reach in its programming, and where CBM Global can bring in, where appropriate, the technical expertise. The joint programming I really liked about humanitarian work on rehab, maybe even inclusive cash, the disaster risk reduction, and also the mental health and psychosocial disability side. The engagement of OPDs also came out in quite a number of cases on how CBM Global can also link up in OPDs from our network. We had examples from Bangladesh, but also in Nepal it was mentioned, the importance of it, and also Kenya. The knowledge development, the tool development, and I think also some of the examples around disability data came in here, and also on the tools that Bimal mentioned. And then I think the very interesting case also in Bangladesh, where it was about the integration of rehabilitation services in primary healthcare. And also that really makes a huge difference in the lives of people with disabilities being stuck there in the refugee camps. So yeah, I think there are so many really great examples that came along. And I really would like to encourage the different country teams, both from CBM, but also from the Red Cross. If you see an opportunity, or even if you would like to sort of have further discussions in your country, please contact CBM Global. I'll share also my contact details in the chat, or reach out to Stephen, and we'll make the linkages, and you can get you can have the discussion further. We're happy to support both Stephen and myself to move forward in this discussion where appropriate and useful. Please let's make use of each other's strengths and make the world a better place for people with disabilities, definitely. Over to you, Stephen. Yeah.
Thank you so much, Sander, and very much echo that. If there's interest to have further support or further linkages, then please do get in touch with myself or Sander or both of us. And we will do whatever needed to make those connections. And thank you for the wonderful summary of the diversity, indeed, very enriching and a lot of scope there. So just one last thank you. I think it's been very enlightening and engaging, and looking forward to further collaboration. We put our links there in the chat. We'll send, of course, there'll be a recording. It's being recorded. We'll upload that to our website so you can access it if you need to. There'll be a bit of a summary, and we'll look forward to further discussions, further collaborations, and thank you very much. Have a wonderful rest of the day, everybody, and see you next time. We'll turn off the spotlights, and anybody who wants to turn on their camera and wave goodbye, you're very welcome to do so. Thank you, everyone.
Thank you.
Thank you.
Thanks so much.
Bye-bye.
All the best.
Bye.
Thank you.
Bye-bye.
Bye-bye.
Have a great day.
Thank you.
Thank you.